Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
Greetings. Thank you for joining us for another What the Health podcast. I am Dr. Dan here with my co-host,
Angela Toro with Toro Family Chiropractic. And another episode here. Got to do the quick disclaimer. You guys know this by now, but we are here for informational purposes. We're here to have a thought-provoking discussion about your health. This is in no way intended to be individualized medical advice for anyone. Always consult your trusted medical provider before making any changes to your lifestyle. So got that out of the way. It actually kind of goes well with what we're talking about today.
Yes, because today we are talking about expert opinions or expert recommendations. And yes, we are putting expert in quotes because who is really an expert anymore? How do we determine that?
I mean, if you look at it anymore, if you listen to the experts, one day eggs are good for you, the next day they're going to kill you. One day coffee's fine, the next day it's going to kill you, which I don't care if they ever tell me that. I'm still going to be, we're sitting here drinking our coffee, I'll still have that. But yes, so we're here to talk about kind of how these recommendations come about and really you as a health consumer, how it's so important to make sure that you are informed and that you know and understand where these are coming from and not just blindly following something because, your best friend's mom told you that so-and-so recommended it, and really making sure that you're understanding the choices that you're making and how it's impacting your health.
Yeah, and it's interesting that you just going back to the whole disclaimer that we do at the beginning. This is not meant to be individual medical advice, but again, so much of what we talk about when we're seeing people in our office is that medicine and healthcare are not synonymous. At least they are synonymous. Unfortunately, that's how societally we have come to understand them. But the way that we look at it is no, they are very unique, separate professions, and medicine is a part of the overarching healthcare system. But, when you look at a recommendation from a medical professional versus someone who is a healthcare professional trying to help you get healthy and stay healthy, those could be completely, in contradiction of one another. So again, if your goal is to, manage and treat disease, those recommendations could be very different from how do I get healthy and stay healthy? How do I optimize, my health and well-being? So I think that's very important for us to understand, what these recommendations are coming out of, where they're coming from. And I think one of the big factors that we really need to start with is where do these recommendations come from? And we were discussing a little bit right beforehand, the fact that they're coming out of research. And because of your background in research, how do all these recommendations come about?
Yes. So something that, through my years and years of schooling, taking a lot of research type classes, working in research, doing my own research, the one thing that we always talked about was evidence-based recommendations or evidence-based practice. So the idea that you want there to be an established body of literature to support what you're recommending, which, yes, is absolutely true. But what's important to understand is that over time, we have come so far in science and medicine, and we have such a huge, just massive amounts of research that is out there now. And so we've gotten to the point that you really it can become overwhelming, and you can really start to almost data mine. We talked about this a little bit in one of our segments, but you can really put together a systematic review for anything and find a certain amount of literature to support that. So how do you determine, you can find, 100 studies that say one thing and 100 studies that say the exact opposite. So what do you do with that? Well, unfortunately, usually the ones that get published are the ones that have the funding to do so. And that's where you really have to be careful when you see something, or even when you do your own research and go out there and see all these articles with all this, look at all these significant results. Well, only until recently, people were not required to publish research when they had a negative finding. So what that means is if they were testing, does this diet impact this disease? Well, maybe they found that it didn't. So they weren't required to publish those findings. They could just toss out the study. Okay, well, not, or maybe they found something else within the study that was significant. So if you looked that up, you wouldn't see that there were, maybe you would see the 6 studies that found it weren't significant, or that it was significant, but maybe you wouldn't see the 25 studies that were done that showed that it didn't have, or maybe it had a negative impact. So unfortunately, it becomes anymore, we are so overwhelmed actually with the amount of research that's out there that it can actually become almost more confusing and more contradictory. And you really want to make sure that you are looking at individual studies, that you're looking at, well-researched, well-conducted studies, which is a whole, I'm not expecting individual consumers to know how to do that. Again, there's entire careers, entire, education pathways to learn how to do that. But that is why it is so important to not just necessarily see one study or one recommendation and blindly follow it. And that's also why we see these mixed results. That's why we see eggs are good for us one day and bad for us the next, because there's studies that show it one way and there's studies that show it the other way. So ultimately, now that probably just made you even more confused, because you were probably expecting an answer, and the answer is it's confusing and it's contradictory. So What do we do about that? Where do we go from there?
And I think, again, to bring it back to like the big picture, is you have to understand that when science is studying a particular variable, right? They're really trying to take the human body, which is not linear, right? We are systems biology is kind of an emerging field, and there's several beautiful scientists, wonderful scientists that have really started talking about the interaction of all the systems of the body, which, again, from a chiropractic perspective and, my background, we talk about the intelligence of the body. If you cut yourself, that cut without thinking about it will start to, it'll get inflamed. You'll have the tissue will start to scar over, and it will heal itself regardless of anything that you do. So systems biology talks about the interaction between all the 13 systems of the body and how they all impact one another. Now, going back to that, when you're studying science, you have to take a specific variable, right? So it's very linear. They want to look at does A affect B and give you a result of C. The problem is when they're doing the research study, they're ignoring D through Z, yes. And how all of those patterns are interacting with the body. So there may be some studies that eating eggs may raise your cholesterol, but they're ignoring the fact that cholesterol may be positive in impacting your body in a very positive way. They're just saying, oh, well, this affects your cholesterol and increases it a little bit, and now we're going to assume that increased cholesterol, because there is increased cholesterol in clots and in vessels. We're just going to assume that if you have higher cholesterol in the blood because of your diet, then we need to eliminate your cholesterol intake. So again, that is a faulty.
Oh yes, as someone who worked in human subject research for about 6 years, I can tell you right now that humans are the worst research subjects, because again, we are, even if you want to try to be compliant, which no one does, no one ever listens, it is very, very difficult to study humans because we are such complex creatures. We are not lab rats that you can control and stick in a box and control what they eat and control, every little aspect of our lives. So when you're looking at human subject research, unfortunately, there's one of two things. You can do a very randomized control trial where you're controlling a lot of variables. That's going to give you a more controlled, a more likelihood that the results you got is connected to what you're studying, like Dr. Dan was just saying. But that's also going to be less applicable to the real world, because if you take that result from a controlled laboratory setting and now you send people out in the real world, well, maybe in the lab, eggs did raise their cholesterol, but maybe when they're out doing their normal day, exercising, going about their day-to-day life, maybe it doesn't. Or maybe, again, their body can handle that level of cholesterol. So that's where it becomes tricky. The other way to study humans is observational studies, which is you let them go about their life and you see what works and what doesn't. Now that's going to be more applicable to the real world, but again, you're looking at them in a less controlled setting. So if it worked for, subject A and subject B, but not subject C, well, now you're trying to figure out why. And so it becomes very, very complicated, and there's really no right answer. It's kind of looking at both and trying to come up with the best recommendation. And when we talk about these recommendations, we are talking about a general recommendation. So we're talking about what works for the masses, what works for the general, exactly, the most amount of people. So that also, within research, there's something called confidence intervals and significant levels. So a 95% confidence interval is what you're generally looking at, which means you're 95% confident that the results that you got are actually significant, that they were actually caused by what you're studying. 95%, I mean, yes, that is pretty high, but that still means there's a 5% chance that those results were just completely random, again, we live in a random, chance-filled world. So there's even debate now within the research community is, do we need to tighten that 0.05 P level? Do we need to make it more of a 99% confidence interval? Do we need to tighten that? Because that 5% chance, if you're talking about the entire population of the United States or the entire population of the world, that's a lot of people in that 5% that aren't going to necessarily work, not going to have the results that they're expecting based off that recommendation.
Yeah, and again, you're trying to control so many things inside that setting, but I want to go back to a point you just made. I don't think you even realized you brought this up, but we're going to go down.
I'm just brilliant like that.
We're going to go down another rabbit hole here. You talked about, randomized controlled trials, RCTs. That is the gold standard in medicine and really scientific literature. That's what you want to do, and that is allotted to when I was referencing the A plus B or A affects B and you get C result. That's what they're really trying to control, right? Because they talk about RCT, randomized controlled trial, double blinded, and
that's the gold standard for drug trials.
That's the gold standard for drug trials. But the problem when you're only looking at these RCTs and you're looking how one drug affects one biochemical pathway in the body, you're ignoring all the other pathways and how they can be impacted when you look at these RCTs. And so, taking, again, we keep going back to cholesterol because we did that podcast recently, and, feel free to jump over and listen to that podcast. But yeah, when we talk about, if you take a statin drug, you're going to lower your cholesterol level, that's been proven pretty.
We're not arguing that.
We're not arguing that. That's pretty significant. But the problem is, then when you apply that research to the masses, then what you start to see is that, they came up with they assumed like, if we can lower cholesterol level, which they can do with a statin drug, you will lower cholesterol level. They assume that, hey, we're going to lower the impact of heart attack and stroke. But now we have, 4 decades of research stating that is not the case. And heart attacks and strokes are continuing to go up in the United States. So we have to take this body of research and say, okay, well, the RCTs say, we can take a drug, we can lower your cholesterol. But when we apply that to the real world, are we having a healthy impact? And the answer, when you're looking at that, is no, it's not. So, you had the RCTs, but then what you said, Angela, is the observational studies. And that's what was so important. And again, I hate to bring this up, but we're in this COVID world now. Gosh, it just drives me. It irks me every time I have to say it, but it's like we have this COVID world and so many people were screaming, that because there was data coming out about early treatment intervention and people were just saying like, well, wait a minute, we don't have randomized controlled trials. And some of the experts, we can, I'll bring up his name, Fauci. Some of the experts were screaming like, well, there was not, randomized controlled, double-blind control trials, but we're going to get into the timeline in just a second because we know how long it takes to do a double-blind RCT study. And we were in the middle of a pandemic that we didn't know a lot about. So what becomes more important? Observation becomes more important and, allowing doctors to do what they do, starting to treat patients as early as possible and see, some recovery rates. So let's talk about that in terms of observational studies versus RCT studies. How long does it actually take to get a body of research to the point point of, okay, now we have these trials, now we can start making recommendations off of them.
Yeah, so some of those, and we're talking about big clinical randomized controlled trials. I mean, you're talking about years, 5, 10, 15, could be up to 20 years of research by the time that those results are getting published, because there is data, there's a whole slew of things you have to go through to even get funding, get approval, doing pre-trial things. You have your actual recruitment time, you have your trial period. Then by the time you have all the data, it can take years to publish that data, especially the bigger the study, the more collaborators you have. I mean, that can go back and forth. You can go back and forth with publishers for years before that data actually comes out. So some of these studies you're reading, these current, I'm putting in quotes again. we need a sound for air quotes.
One day we'll have a video podcast.
Some of these current studies that you see, that data might already be almost a decade old. And so it's just important to understand. And it's not saying that data is useless.
Correct.
It's just saying, it's understanding that, when you see something new, in the research world, new is scary. Because again, we don't have the body of evidence. Well, of course, you don't have the body of evidence for anything until you have it. But it's not to say that there isn't merit to case studies, to observational. So a case study is, a single person that had this experience. And that's a lot of the times where what is going to become an expert recommendation starts from. We see something, that would almost be marked as a miracle, or something that can't really be explained. And we're like, why did this person have this reaction and have this positive, impact? And okay, well, let's look into that. Let's pull that apart a little bit more. Let's try to figure that out. But yeah, unfortunately, that timeline, and again, like you were talking about, in a very time sensitive situation, like when we're dealing with the global pandemic, it's not that you want to just guess, but observational studies aren't guessing. It's based off of, again, it's still based off of research. It's just a different type of research. It's looking more at, okay, what do we know? We know this works for this. We know that this is similar to this. So, okay, let's see how this works. And unfortunately, that's, when you're talking about a short amount of time, that's going to be the route that you have to go, because we don't have 10, 15 years to compile this amount of evidence.
Correct. And that's the whole argument. And that's where, again, allowing scientists and doctors and health professionals to do what they do best, because human physiology, that's the one thing that hasn't changed.
It's not.
Now, we are learning more and more and more about the intricacies and how it all fits together. Again, I love the, psychoneurological immunology theory, and just, again, how the immune system ties in with the nervous system, ties in with the endocrine system, and how all of those communicating hormones, neurotransmitters, cytokines interact with one another, and how they bridge together. And that just works so amazingly and beautifully across the body. We're learning more and more about that. But human physiology has not changed. What has changed is how we are observing it.
Exactly.
So to get back to that point of, how long do we allow for things to unroll? Allowing doctors that are familiar with physiology and pathophysiology and how the body responds in different ways, and be able to use that expertise to make clinical decisions. As a clinician, you're a clinician, Angela, I'm a clinician, we're working with patients individually, one-on-one. So we have to, look at the body of evidence, and also look at the person sitting in front of us to make our best expert recommendations for that person sitting in front of us right there, right then. And if we make our recommendations solely off of studies that are just coming out, the new studies, like you said, that information could be 20 years old. Mm-hmm. And what's even more scary, you're just talking about the publications of that research. Now let's talk about that research making it into a textbook. Mm-hmm. I have heard numbers that our textbooks that we're studying out of, they could be 3 decades old. That information could be 3 decades old by the time it actually hits a textbook and you're starting to study out of it. Now, again, we understand that, physiology, anatomy hasn't changed. It's, certainly how we are observing that and understanding it more and more. But when you have a clinician, you have to make the best recommendations, based off bodies of evidence and observation, and also what has worked in the past. So again, medicine or really pharmacology, they want to poo-poo observational studies because the problem with that, because they can't isolate, right? They can't isolate A plus B equals C. But when you look at something like chiropractic, it does not have a lot of randomized controlled trials, because how do you double blind someone to give an adjustment? It's very hard. You don't want your chiropractor giving you a blind adjustment.
Yes, yeah.
All right. But what has happened is when you take a systematic review and you look at the body of evidence and the millions of testimonials, and testimonials are, simply a case study that's really kind of, not necessarily published or documented, but you got a testimonial of someone who, well, I have better energy, or my digestion improved, or, I'm thinking more clearly, or, my arm numbness went away, my headaches went away. You have all of it. My baby is sleeping better. My baby's pooping better. Like, you have all of these individual case studies, and very similar spinal adjustments may have been given. But when you take those individuals, they're not very strong. The individual case study is not very strong. But now you stretch that out over, chiropractic has now been been around for 120 plus years, since 1895. Now you take that and spread it over 100 plus years. And you start to look at there are millions of people, tens of millions of people who have positively responded to this type of care, then there's something to this.
And I think you bring up a really good point, which there are certain things that just cannot be randomized and controlled. And actually, a lot of the stuff that we know and recognize today was never done off of a randomized controlled trial. So if you think of smoking, if I say smoking, who's sitting there going, oh, yeah, that's good for you? No, that is widely recognized. We know smoking is not good for you. Lung cancer, other issues. We know this. There was no randomized controlled trial where somebody was randomized to being forced to smoke and somebody else was told not to smoke, and they followed those people for 20 years to find. No, we figured this out based off of observing that people who were smoking were getting sick at higher rates. And so that what is now a very clear and well-established expert recommendation was based off of, again, just observing what's happening, observing behavior and observing that correlation. And that a lot of the times, again, certain fields like, in the health field, sometimes it's like, oh, well, that hasn't been proven. Well, how do you necessarily prove something if it's working, if people are coming in and they're healthy and they're feeling better and they're having a good quality of life and they're staying out of the hospital? What's the problem?
Yeah, exactly. How much more proof do you want?
So it's just, a certain thing, acupuncture, same way, gets the same kind of reputation. Even massage therapy, we swear, we get our monthly massages, we swear by that. And, but you could say, well, there's no, and there is literature that shows massage helps with certain things and that and this and.
Yeah,
but again, how do you do a randomized control? I want to get randomized to the group that has to get the weekly massages. That'd be great. I will sign up for that study. But yeah, so it's recognizing that not all things can be studied in that fashion, and recognizing where those recommendations are coming from, and recognizing that observing what works and what doesn't is a really important thing.
Exactly.
It's a really, really important thing.
Well, and it comes down to this, again, this is made popular in the last, 2 years about the trust the science, right? This term, trust the science. The problem is science is ever changing.
Absolutely.
We're constantly seeing more information. And again,
that's the whole point of it.
That's the whole point of it, right? You put forward a question. This is my hypothesis. I'm going to ask this question. If we do this, will this affect this? And we're going to, observe how it, because even randomized control trials are observational at their core, right? You're saying, hey, I'm going to, take this person with this condition. I'm going to give this medication, and we're going to see the result. That's observation. observation. So really all science is asking a question and then observing, the variables around that question and see how someone responds. So again, it's like we have to look at this, the whole body of evidence, the gold standard. The gold standard was made the gold standard of RCTs because that's what worked for pharmacology. But that doesn't necessarily work when you're looking at a human being, at you as the individual, healthcare receiver, and you're trying to make the best recommendations based off of experts. One of my favorites, just to finish up with that thought, one of my favorites, and I heard this at a seminar one time, was there are no double-blind randomized control trials for parachuting, wearing a parachute when you're skydiving. So I don't want to be the one to sign up for the control group on whether or not parachutes are effective at maintaining your life when jumping out of an airplane.
Also brings me back to what Mom would always say growing up. It's your friends were doing it. Well, if your friends jumped off a bridge, would you? And it's like, well, no. So again, it does come. You talked about this trust the science and versus we follow the science. But what I always say is I trust my body because that is the thing. Is it's you are the only person who knows what you're feeling and experiencing on a day-to-day basis. You can try your best to describe things to your doctor, to your friends, to your family, but you are the only one experiencing what's happening to you on a day-to-day basis. You know when something's right. You know when something's wrong. So I talk to people about that all the time. We're like, well, I heard eggs were bad for me, so I stopped eating them. And I'm like, okay, well, what's your concern? Okay, well, is it your cholesterol? Your cholesterol is fine. Okay, well, are you concerned it's making you sick? Well, you said it doesn't give you any GI upset. Are you? So again, if you've been eating eggs your whole life and you feel fine and your numbers are all fine and you have the energy and they give you energy, then you're just going to stop based off of what? Because again, somebody somewhere said something and it really comes back to that idea. Now, again, if you're eating eggs and then feeling violently ill, well, then that's a different story.
Correct. That observation would tell us, hey, maybe it's time to back off of that. So
that's where, again, it's really important to listen to your body. And we talk about this a lot because it is so important because, yes, there are always going to be endless recommendations out there. They're always going to change. Oh, he's pulling out the book.
We have a great chapter here, chapter 4 in Design to Heal, Your Guide to Get Healthy and Stay Healthy. Written by me.
That's Dr. Dan's book.
This is my book. But again, chapter 4, the body is designed to warn you.
Yes. And we have to learn to listen. And again, you have to learn to be an advocate for your health and you have to learn to question, even your we always talk about your trusted medical professional. Yeah. Well, you need to be careful who that trusted medical professional is because, we talk about all the time that people in the medical field are taught medicine. That's what they're taught. And again, it's nothing against them. That's what they're taught.
That's the toolbox.
And unfortunately, some of the recommendations, especially I got to bring up in the cardiology world, are so outdated at this point that it's actually becoming infuriating. Yeah. So, and we'll do a whole segment on that, but I have to talk about, because you're talking about expert recommendations. Yeah. So who do you trust more than your doctor? And so we actually had a patient just this week come in who had recently suffered a heart attack. Luckily, he's okay. And, as we talked about, heart attack is often the first sign of anything being wrong as far as heart disease.
Yeah, the heart attack itself.
That is the first symptom, even though it started, the issues started 20, 30 years ago. Yeah. But, I was asking him, okay, well, what else, other than they put you on a water pill, did they put you on anything else? Any other recommendations? And he's like, oh, not really. My cardiologist said, he doesn't really care what I eat as long as I'm, getting like 30 minutes of cardio in a day. Mm-hmm. And I actually had to clarify, I'm like, he doesn't care what you eat? He's like, well, within reason, like I'm not going to go crazy, but yeah, he said he doesn't really, nothing specific. He's like, well, obviously I'm going to do like the low fat, low sodium thing. And I'm just sitting there because what he said was just repeat back what his cardiologist said, which is what probably every cardiologist would say. But in that short time, I heard so many things that were just concerning because, and it really is. And that's where, he's going to be going off thinking that, now again, luckily we'll be able to sit down and talk about how absolutely diet is going to affect your heart health and future occurrences of this, how exercise, 30 minutes of cardio is absolutely not enough to help. And like, we're going to dive into all of that in a lot more detail. But it's just very concerning that these are the kind of things that trusted medical professionals are saying, because I don't see how it's 2022 and anybody who works in the health field could make a statement that it doesn't matter what you eat. Yeah. Or it's just, that is mind-boggling to me. Yeah. So that is where, again, we need to be careful we need to be careful, and we need to be advocates for our own health. And that's what we're always going to say.
Well, and you bring up such a good point of who do you trust, right? Trust the science.
Trust the doctors.
Trust the doctors. Trust the experts. And you just said it. And again, unfortunately, and this is not to say, this is not to say medical doctors are bad, not to say other healthcare practitioners are bad, but so much of what they gather in terms of the body of information and these recommendations are just parroted from these major health organizations. But these major health organizations are impacted by massive amounts of lobbying. So we're going to go into what my favorite. I got to cue up. I got it. My favorite segment. Follow the money. But you're right. It's infuriating because they can take observational data, systematic reviews, and they can find in the research that such and such this affected this and that affected this, and so we get this result, and they can come up with a recommendation. And massively on a national and global scale, make these recommendations that, from a societal perspective and from a scientific perspective, they have it proven. But when you start to look at it individually and how much that's impacting someone's health on a negative basis, it's infuriating. Mm-hmm. As people who care, as clinicians who care. So you have to have that gut check time when you are sitting down with your doctor. If something that they are saying is causing the hairs on your back to go up, or just making you go, huh? Like, you need to, second opinions are a very real thing. Absolutely. So, if something your doctor is saying is not agreeing with you, and you feel that you're being negatively impacted by a medication, I'm not telling you to stop taking medication, but if you feel like you're being negatively impacted by a medication you're taking or by a recommendation that was made, then you need to go at least talk to someone else. And if you find that information was wrong, or you find someone else that you trust more, or someone else that could then become a part of your team, maybe it's time to fire your primary care professional. So, and again, I'm not encouraging everyone who's listening to this to go out and fire your healthcare provider, but you need to find someone that you trust and listen, and ultimately someone who has some humility. I've got to share this because this just came across, my table. Someone came in and she has been having some significant jaw pain on her left side for months. That was actually the reason that she started care. And so, there was something that was showing up on the left side of her jaw and left side of her spine that I started working on. But she's been getting a lot of changes. Again, this is the systems, approach. I'm changing. We're making some positive changes in some areas, but her jaw was not being impacted, and so. She said something that she's like, when I press on the right side of my jaw, it's the left side that's hurting and clicking and popping and feels like she can't open her mouth to the point that she can't eat because it hurts so much when she tries to open her mouth to take a bite. She's like, but if I push on the right side of my jaw, that seems to give me the best relief, or at least to the point that I can open my mouth and take a bite, but still obviously it goes right back after she takes her hand off of it. So I was humble enough to take a step back and say, okay, I know I was seeing a lot of stuff on the left here, but she's telling me something. She's listening to her body. She's giving me a piece of observational material that I can then use as a practitioner. So I reanalyzed the jaw, and I did find something was changing. And there was something that, whether I missed it at first because we were focused on the neck and the left side of the jaw where the pain, but whatever the case was, something had shifted or, again, humility time. We do miss stuff as clinicians.
We're human too.
We're human too. No one's perfect. So I started, at her last visit, I started working just based on that new piece of information and some of the new analysis that came out in terms of how her jaw was deviating. I started working more on the right side of that jaw. And by the end of the visit, she said, this is the most amount of relief that I feel we have gotten out of her previous, 8-10 visits leading up to that. So that's the humility. That's the facilitator, the role as the facilitator when you're looking at health and healing. You have to have that expert on your healthcare team that is going to listen and make recommendations that are in tune with you and your body as the individual sitting in front of there, not solely based, certainly want to include scientific data, but not solely based on the mass, okay, right? The massive, the societal versus the individual, okay? And as clinicians, we're working with individuals. So it's very important, again, as Angela just said, becoming your best health advocate. That's something that we talk about all the time for yourself and your children if you have a family. Making sure that you are becoming the biggest health advocate. And so much of that is trusting, your intuition, your gut about how your body is changing, whether positively or negatively.
Absolutely. I think that might be a great place to end it. That is very, very well summed up.
So trusting the experts. We really want to thank you so much for listening. Again, a lot of information. If something resonated with you, we always like to say, reach out to our office. We have a website, Turo, Turo, familychiropractic.com, where there's a ton of information on there that you can dive deeper. But if you really are just looking, to maybe you're in the, southwestern Pennsylvania area and you're looking for that second opinion, or you just need to, so you're somewhere across the United States or, hey, maybe across the world that's listening to this, and you need to help finding someone that can guide you, that is going to be a little bit more local. We help people all the time find those individuals. We do have contacts all over the nation and certainly some over the world that we can connect you to people who are going to help you find your expert that you can trust, have confidence in, and ultimately help you get healthy and stay healthy for a lifetime. So with that being said, I am Dr. Dan.
I'm Angela. Thank you guys so much for listening.
We'll see you next time.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.